On the occasion of World Arthritis Day, I would like to speak about arthritis. Arthritis usually is the age-related degeneration of the joints, and it is commonly seen in knee joint, hip joint, shoulder, elbow, ankle, and even small joints. In the early stages, the patients of arthritis would have swelling, sounds coming from the joints, and in advanced stages, the patient would have a deformity and they would not be able to walk properly or would have a waddling gait once they walk. So all these things are early symptoms of arthritis, and if the arthritis is progressing, you must consult an orthopedic surgeon. So usually in the initial stages, if the patient has arthritis, we recommend them to do some lifestyle modification, lose the weight, do some physiotherapy, take medications for cartilage repair and also lubrication, and we also advise them to consult an orthopedic surgeon. If the arthritis is advancing, we usually recommend them glucosamine tablets and capsules and also injections of hyaluronic acid. And in some cases, the arthritis can progress to an advanced stage where we recommend them to undergo a procedure called total knee replacement, where the joint ends are actually replaced with metal and a plastic spacer is placed in between. Knee replacement is a very successful surgery. It actually corrects the deformity, it gives you pain-free motion, and it can last a lifetime. So arthritis can be treated and you can have a pain-free mobility for your life once it is treated in recommended way.
I'm going to talk more about the arthritis of hip joint. Hip joint is the largest joint in the body, and it is a weight-bearing joint, so all your body weight is transferred through the hip when you walk. And because of this, arthritis of this joint can be very severely disabling if it is not treated properly. The most common cause of arthritis of the hip joint is called primary arthritis. So essentially there is no cause for it. Other common causes include avascular necrosis, and you would have heard this term more and more in post-COVID era, because COVID seems to have increased the chances of having this disease. The other common causes include tuberculosis of the hip joint and also other infections. What is common amongst all the causes of this is that pain, stiffness and limp will affect your life, and you might see your doctor for one or more of these symptoms. You might not notice the limp yourself, whereas your friends and relatives might tell you that you're limping. The treatment of this disease will depend on what grade you present to when you see us in the office. In mild to moderate stages, where you have still a little bit of cartilage left on the femoral head, we will try and treat you with non-surgical options, amongst which important ones are strengthening of the muscles with physiotherapy, gait training using walking aids such as a walking stick to walk. We might prescribe you some painkillers, but for short durations, and obviously taking painkillers without the doctor's advice for long durations is not advisable. They can also have side effects. We will also tell you to incorporate some lifestyle modifications into your daily activities. If the severity of the disease is not controlled by these measures, or if your life is really disabled because of arthritis, the only option we have in the end is a hip replacement surgery. It's a very successful surgery. It's been termed the operation of the century, and for good reason. It has one of the best short-term and long-term outcomes of any surgical procedure in all of medical science. So whole idea of telling you this is that don't neglect this disease. This disease can go downhill very quickly. When the anatomy of the head of the femur gets altered, you might notice a very acute reduction in mobility. A patient can be bedridden in a matter of weeks because of this. So this is not something you should neglect. You should see your orthopedic surgeon if you have any of the symptoms like pain, stiffness and limp.
So every day in my clinic, I do see great number of patients with arthritis involving various joints in the upper limb, such as shoulders, elbow, wrist, and even small fingers of the hand. They do come with different symptom severity. Few patients will have just nominal pain, but majority of them will have severe pain, which can cause even sleepless nights, or they will have different disabling functions. They can't pick anything from the floor, or they can't do household work, they can't play with their kids, they can't play badminton. So the symptoms can vary a lot. few patients will have these symptoms because of what we call as age-related osteoarthritis, and some patients will have age-related tear in the muscle, which can cause arthritis. In elbows, commonly we do see patients with previous trauma, which has led to post-traumatic arthritis. Now, when the patients come, we make a customized treatment plan for each patient. Which can range from a healthy lifestyle, doing some exercises, strengthen the muscles, keeping your movements in the joint. When these symptoms are not controlled by these measures, we do have different options, what we call as biologicals or regenerative treatment options. Eventually, if these all things fail, we end up giving them a surgical solution. And in today's days, surgical option is a very good option with a very good survival rate. You can have a painless life for your whole life. So I think in these days, arthritis is not a disease to be worried at. You can have a very active and pain-free life. We wish you all arthritis-free life.